So, hello friends. Let's start our discussion for the reproductive and child health aspect of SPM. The topic is very important because each year some question is asked. Broadly, we will be dividing it into three subtopics. First topic would be the coverage of journal ideas of about reproductive and child health care, where concepts would be discussed along with what are the various programs, especially the RCH program, and how it is being implemented in the country, what all services are provided under it. And then we will individually look at the obstetric care, or what we can say reproductive care, obstetric care, and then child care. So broadly in these three, under these three broad parameters or discussions would be conducted. First of all, let's start. Now again, the source is Park's textbook. Mm, First idea is we generally consider mother and child as a single unit, and it is a single unit. So if it is a single unit in various programs, there are many reasons why we do so. So it is because of primarily six reasons. So this itself can come as a question: why should we consider mother and child as a single unit? First reason is that during antenatal period, we all know that fetus is in fact a part of mother. So they are inseparable in this regard. Second is that child health and maternal health, they are closely related. If a healthy mother is there, healthy child would be there. Then third aspect is that there are certain diseases. So one is about health, one is about diseases. So that there are certain diseases uh, of the mother in pregnancy that have impact on the fetus. So what are these infections like torches infections, like so syphilis, measles, and then drug intake. So all these diseases in mother um, has an impact on child. So first reason is that both antenatal during antenatal period, both fetus and mother are the same. Second and third, with regard to close association between child health or diseases with the mother's health. And fourth element is that after birth, child is generally dependent on mother only, and up to the age of 6 months, she is dependent on the breastfeeding. Then later on also, most of the dependence of the child is on the mother. Fifth reason is that so there are so in care cycle of women, generally, so what happens is that during the care cycle of women, the child services are required both ways. So what is it that, for example, in a postnatal, that after delivery. So during this period, services are to be provided to the woman. At the same time, you have to give newborn services also. So in the care cycle of a woman, the service delivery to child and mother are at the same time. So so it's better to have a program which caters to both, providing both the services to both the mother as well as the child, because at the same time the requirement of services is there. And finally, mother is considered as the first teacher of the child. So this way, there are the six reasons why mother and child should be considered as a single unit during the antenatal period. They are the same. There is a close association between child health and mother health, and mother diseases and child diseases. After birth, the child is dependent on the mother. Then, in the care cycle of women, both child maternal and child services are to be provided at the same period. And finally, mother is considered as the first teacher. Now let's move on to some social aspects. What are these fields that sometimes questions are asked? Generally, initially, the obstetric and newborn care. So that was the idea. So obstetric care used to focus only on the antenatal delivery and postnatal services. Obstetrics was curative service, more of a curative service. So in this regard, what happened is that certain developments, with the passage of time, it was realized that the social elements also play a role in obstetric care. So we have the science of social obstetrics coming up. So what is this social obstetrics? So it is basically a study of interplay of social and environmental factors and human reproduction. So rather than only focusing on the medical aspects, the social and environmental aspects of factors that play a role in the reproductive health of a woman are taken into account. Similarly, there is something called preventive. So we have idea of this thing pediatrics. So pediatrics generally gives talks about giving newborn services, giving services to healthcare services to infants. So pediatrics and children also. It focuses on curative aspects, but there is a new element that comes up with the preventive pediatrics. So what the focus of preventive pediatrics is that preventing the diseases from occurring. So all the diseases and disorders that a child has. So if you prevent it, then it is called preventive pediatrics. So it has two branches, antenatal and postnatal. So the antenatal would be that we will be identifying and screening the fetus for certain developmental abnormality, for certain diseases, deficiencies. Then postnatal also, we will be screening and treating them. So the preventive pediatrics is about this thing. However, there is a third term also, social pediatrics. So social pediatrics is about again understanding the linkage of social and environmental factors with the pediatrics health. So these terms, like for example, preventive pediatrics was asked once. So again, in order to answer such a question, first we have to define it. We will have to divide it into various types, antenatal or postnatal preventive pediatrics. Then we can give examples of antenatal and postnatal services where screen, where we treat. So similar is the way of social obstetrics. We have to define it and then give examples of social obstetric. For example, we can say um, how the age of marriage impact the obstetric history. If the age of marriage is less, there are more chances of early childbirth, more obstetric complications during the childbirth. So all these problems, we have to explain it with the help of examples. So with this, we now have to understand something called what is maternity cycle. So what is maternity cycle is basically there are various stages in maternity cycle. First stage is that fertilization. So fertilization of ovum and the sperm happens. Then would be antenatal period, or is all called prenatal period. So then intranatal period. So that is the delivery type, and then uh, again postnatal period. If after postnatal would be interconception period. So there are five elements to maternity cycle: fertilization, antenatal care, intranatal care, postnatal care, and interconception period. So now we should know certain time periods. For example, fertilization. If we say the ovum is released, so what is ovum? What is embryo? What is fetus? So ovum is still 0 to 14 days. Then after fertilization is it becomes embryo, and embryo is from 14 days to 9 weeks, and from 9 week onwards it is fetus. You remember this, 9 weeks onward we have fetus. Now so antenatal, intranatal. So at this point we have preterm and term, preterm, term, and postterm. So preterm would be 28 to 37 weeks. Then term would be 37 to 42 weeks, and more than 42 weeks would be postterm. Baby and postnatal period is after the birth of the baby. So with this, we know what is maternity cycle, and finally, let's move to some thing about what is MCH problems. So mm, MCH, maternal and child health problems, are unique to each country. So we have to ensure that it is unique to each countries. So these are those problems, not all problems of maternal health, child, but those which are of public health significance. And for developed countries, it would be different. For a developing country, it would be different. In case of India, the MCH problems are a triad. So what is the triad? Triad of MCH problems. One is malnutrition. We have malnutrition, then infection, and unregulated fertility. So these are the major what we'll say that MCH problems of a developing country like India. So with this, we can know the concepts. We have completed the concepts. Let's come to the programs, broad framework about the programs of RCH program. So first of all, India was we historically take pride into it that in 1951, we were the first country in the world to launch a national family planning program. So we launched national family planning program in 1951, and we were the first country in the world to do so. Afterward, what happened was that this national family health program took new shapes with the passage of time. First thing, the development was in 1992, then was in 1997. So presently we are having this 1997. So these years we have to remember. This can give a broad idea what how the things evolved. So we had the national family planning program. Then we have the child survival and safe motherhood. So what is the difference between family planning and child survival and safe mother? Because we added these maternal and child health care services into it, along with contraception and all this maternal health would add to form reproductive and child health care program. Along with this, and then in 1997, we had something called reproductive RCH program, reproductive and child health program. RCH has varied phases, phase one, phase two. Now it is a part of National Rural Health Mission. So now again, which is a part of National Health Mission. So what was the difference between child survival and safe motherhood and the RCH? Is that the reproductive health was added. So what is the reproductive health? Sexually transmitted infection treatment. These things were added. So let's see what is the obstetric care in RCH program. So RCH program, as we know, it's a part of National Health Mission. So it is a sub-component that deals with reproductive and child health. So it has again three components: obstetric care, this child care, and then what we have is that offer reproductive tract infections and all these things are there. So what are the various services that are provided? So let's first focus what are the obstetric services. So with regard to previously it was called obstetric services, now it's called obstetric and newborn services. So these services are basically divided into two subparts. One is essential ops and newborn care. So these are essential services that are to be provided, and who will provide it? Medical officer at the PHC level. So MBBS officer at posted at PHC level would provide essential obstetric and newborn care services at the newborn care. At the same time, we have emergency. So obstetric and newborn care. So EMONC. So emergency obstetric and newborn care. This is further divided into basic and comprehensive. So we have this basic emergency obstetric and newborn care and comprehensive obstetric and newborn care. So basic would be on smaller scale, but this comprehensive. So there is a fancy term used, BMONC. B means BEMONC, and CMONC. So what are where are they provided? So this would be provided at the high level PHC, like 24/7 PHC, that is working basic services would be there, and the CHC level. Here, the first referral unit. So first referral unit are those CHCs where from PHC referral is there, and district hospitals. So at the level of PHC, comprehensive services are not there because blood transfusion is required for that. Specialist care and all these things are needed. So let's detail first of all what are these services. Then along the maternity cycle, we will try to identify what are the services that are provided. So that way we will move on to the second part. So let's first of all enumerate various services we are providing. So again, let's first see what is this essential obstetrics and newborn care. What are the so again at the PHC level it is given there are 5 components to it. So first thing would provide registration. So registration of the pregnancy. If a female gets pregnant, she should be registered within 12 weeks, and the duty is the auxiliary nurse midwife. ANM duty is there. Then we will have to provide ANC care, antenatal care. Then we have to provide safe delivery. So along these lines only we will be discussing safe delivery. After a delivery, we have to provide postnatal care, and finally, along postnatal care, we would have to provide newborn care also. So this is essential option newborn care that we have to provide it. Second aspect is the basic emergency obstetric and newborn care. So what kind of services are there? So again, this would be provided by 24/7 PHC, or we have to provide CHC. But best place would be CHC because the the MD of OBS would be there to provide these kind of services. What are these services? There are 7 services. So these are specialist services. So first would be manual removal of placenta. So like during delivery, manual removal of placenta is there, and again oxytocins in order to make it fast. If there is a infection, so infection treatment by giving antibiotics, then treatment of convulsions like through anticonvulsants. Then if there is a need of assisted delivery would be provided. Vacuum aspiration would be there, and finally, so these are to the mother, like we can say oxytocins would be given when she is having labor pains, when the time for delivery is there. Then during delivery, antibiotics, medicines would be there, like antibiotics, anticonvulsants would be provided. Then surgical methods like manual methods like manual removal of the placenta, then surgical methods like assisted delivery, vacuum aspiration, and seventh would be newborn resuscitation. When the child is born, so we will provide newborn resuscitation. The second aspect is CMONC. So this is comprehensive. It has 9 services. The 7 previously given. So again, oxytocins. We will provide oxytocins initially, then antibiotics, then anticonvulsants, then manual removal of placenta. Then we would provide after manual removal assisted delivery, then vacuum aspiration, and newborn resuscitation. So these 7 services are out there. Along with that, we will provide blood transfusion services, and then surgery like obstetric, this cesarean section, and all these services will be provided. So with this, the first aspect our discussion comes to end. We would now discuss the second one. So we had discussed about the in the first part we had discussed about what are the, like, we can quickly revise it. So we dealt with the general aspects. What are the various concepts? Well, like what is maternal child? Why it is called a single unit? What are the various branches? Social obstetric, preventive pediatrics, social pediatrics. What is the maternity cycle? What are the MCH problems of India? The triad. Then how the program evolved, and what are the basic services that are provided. and sexual obstetric and newborn care services are there. So that is there, and then the monk, CMONK, all this there. Now let's move on to the specially obstetric services. So reproductive element. So reproductive, so the female related services that would be provided. So what would be the framework of our discussion? Again, Park would be our guiding. So first we'll discuss what is antenatal care. So all the aspects of antenatal care. Then we will be doing prenatal, so this intranatal care, postnatal care. So after the postnatal care, we will be providing the newborn care. Then after newborn care, we will be tackling about some unique aspects related to the newborn care, like Kangaroo mother care, then feeding, breastfeeding. What are the advantages of that feeding comparison of various breastfeeding initiatives, then baby-friendly health initiatives. So this would be the first part till the newborn care. Then the child. Then we will be in the third part. We would be tackling about the child health aspect of this program, the child health risk growth charts. Then along with the child, we would also focus on these various health programs at the international level, also at the national level, including the this ICDS program, which is a very important program and which is at the backbone of integrated child development services. So let's start with the antenatal care. So again, what are the antenatal care like components of antenatal? There are three components of antenatal care. First would be risk identification, then prevention, and management of health related, pregnancy related or concurrent diseases, and third would be this health education and promotion. So, so health education, promotion, risk identification, prevention, and management. So this is the curative aspect. This is the preventive aspect. This is the promotive health education and promotion. So let's start with the technical aspects. What is antenatal visits? So, generally it is recommended that there should be ideally 13 to 14 antenatal visits, but minimum visits should be at least four or more than four visits should be there. So, what are these visits? The timing for these visits: first visit, second visit, third visit, fourth visit. So, first visit has to be done within 12 weeks of pregnancy detection, and it is the responsibility of ANM, auxiliary nurse midwife, at the primary health center level to register the pregnancy. Then would be second visit. So second visit would be between 14 to 26 weeks. Third visit would be 28 to 34 weeks, and fourth visit would be 36 weeks to term. So, this visit, the first visit is very important. So it is the responsibility of ANM. It has to be done in 12 weeks, and ANM can use various mechanisms in order to identify pregnancies, because she is a member of like she is allowed to attend village health nutrition day. So during village health nutrition day, she can take it as an opportunity uh, in order to identify those females who have become pregnant recently. So that is there. So then second would be second visit 14 to 26 weeks. Uh, third visit 28 to 34 weeks, and after 36 weeks we have last two visits have to be done by medical officer. So here the medical officer would have to see the pregnant lady. Now ANM now is, first of all, we know that she has to go and visit the village health and nutrition day to identify pregnancy. Plus there is a simple tool in order to identify number of pregnancies in a community by ANM. So this can be asked. So what is there to ensure whether complete registration has happened or not? So how to know why how much expected pregnancies should be there in a year in a particular area? So the formula for this is that expected number of live births per year, live births per year is equal to birth rate into population of that area divided by 1000. However, what happens is that uh, so this is the idea. So for example, birth rate of a region is 25 per thousand. So 25 per thousand, and the population of the subcenter is 5000. And if you divide it by thousand, it would be 125. But the point is that what happens is that this is based on birth rate. Some births would be live births, some would be still births, or some may be dying. So a correction factor of 10% is added to it. So 10% would be 125 plus 10% would be 12.5, we can say 13. So it would be 138 pregnancies. So this would be in a particular year, 138 pregnancies. In order to identify whether, because she has to comply the data of 1 month. At a particular subcenter during a month, how many expected registration of pregnancy should be? That a rule of thumb is that because the pregnancy is for 9 months, so we can say uh, half of this number would be registered at one particular time, say in 1 month. So we will divide it by 2. So 69 pregnancies should be registered in a month in this particular subcenter. And if it is less than that, that she should go into for a house to house whole survey in order to identify those women who have not been able to do this. Now, next is what are the various services that are provided during these ANC checkups. So first is history taking is done, then general physical examination where pilot pulse, edema, and all these aspects are taken. Blood pressure are taken, uh, and then weight is taken. Then abdominal examination is done. So abdominal examination, then fetal height, fetal heart sound, fetal parts, multiple pregnancies. Then we have to assess gestational age. So gestational age, uh, we can go for LMP method. Uh, then we can go for this ultrasonography method in order to know the gestational age of the female. Then we have to order lab investigations, and so these are the various services that we have to provide to the female. Along with that, we have to provide, again, as we said, there are three components of antenatal care. So one is the management of pregnancy, then health promotion, and then we have health promotion. Then we have preventive services also. So in the preventive aspect, so like in health promotion, some counseling would be there, counseling and intervention would be there, and interventions would be iron and folic acid would be there, immunization, tetanus immunization, uh, and then uh, instructions on nutrition, then home visit by health worker, referral services, then a various program, Janni Suraksha Yojana would be the idea about these things would be given. In the prevention, we have risk approach. So the risk approach, what is this risk approach? Is key. We have to identify high risk cases like early primary gravitas, short stature, prolonged pregnancy, and we have to provide a higher set of maternal and child health care services And then finally, maintenance of records, mother and child protection card. So here we can say what are the interventions and counseling services that are to be provided are that first of all, this iron, folic acid, and immunization. These are technical aspects. Other aspects, intervention and counseling, like instructions of nutrition, home visits, referral services, and information of health programs, etc. So let's deal with this specific this IFA component and tetanus immunization components. So what is this iron and folic acid supplementation? This is under Anemia Mukt Bharat initiative. So what are there? So we have some adult and then pediatric. So to the child, what would be given and how to adult. So we have to give this dose to the females. If the child is born, pediatric would be given. So let's take the adult aspect. So there would be two components. One will be elemental iron would be there, and then folic acid would be there. Elemental iron would be 60 milligram, and folic acid would be 500 microgram, and it would be available in red tablets. Remember this thing. The color of the tablets would be red tablets, and it has to be given in second and third trimester, once at one tablet a day for 180 days. And then after the birth, 180 days of lactation. So total of 360 days of iron and folic acid supplementation has to be provided. So this is the technical aspect with the regard to iron, folic, and then TT injection has to be given, immunization is to be given. If a lady is primary gravid, so we have to give two doses, 1 month apart. If next pregnancy is within 3 years, and we have a documented record that the vaccination has been given, only one booster dose has to be given. So otherwise, if it's more than 3 years or this dose is not registered, then we have to retrieve the tetanus 2 doses. So this would have to be given. So this was the antenatal care services. At the same time, in the counseling aspect, we have to provide prenatal advice to the female. So what are the talking points of prenatal about? First would be about the diet, how much diet should be provided. Then focus on personal hygiene. Then care should be taken not to take some drugs. Then radiation should be avoided. Then child health should be focused. And finally, warning signs should be told, like swelling of the feet, fits, headache, blurring of vision, bleeding or discharge per vagina, any other unusual symptoms. So these things should be told to the mother. So with this, I think we have done the antenatal care. Let's move on to the intranatal care. So the emphasis of intranatal care is on the cleanliness. Cleanliness is should be the focus area, and we should focus on 3 C's: clean hands, clean delivery surface, and clean code care. So what would be clean code care components, subcomponents? Clean blade, clean cut, and clean tie. So these cleanliness should be the primary focus of intranatal care. So that is the thing that we have to take in. Now then there is something called domiciliary care. Domiciliary care. So if the care is provided within the confines of the home, then we say that obstetric care is in domiciliary care. So here there are certain advantages of a domiciliary care. First advantage is uh, she will have a delivery which would be done in familiar surroundings, like in family surroundings of the home. Second is the chances of cross infection, that is one pregnant female. So in hospitals, what happens is that various pregnant females have. So let's pause for a time.